Hello, I'm Mike Rossi. I'm an assistant professor in radiation oncology and pathology at Emory University in Atlanta, Georgia. I'm here at the ASH meeting presenting a study looking at improving the diagnostic paradigm in multiple myeloma by using RNA-Seq, SNP copy number, and deep sequencing. Our goal is to develop advanced diagnostics for multiple myeloma. So we're in the process of using next-generation sequencing and advanced array technology to be able to identify high-risk patients and molecular mechanisms that may give us some type of indication on how best to treat those patients. What we presented in our study is RNA-Seq, SNP copy number, and deep sequencing in a patient with multiple myeloma who had advanced disease. And this is a paradigm that we're developing for all our high-risk patients where we do next-generation sequencing and copy number analysis to be able to identify specific changes that are happening in those patients so that we can understand in more detail the molecular mechanisms that are driving their myeloma. We're using this to combine with how we treat these patients and combinations of therapies, and this is very important in being able to understand how specific patients present with disease and then how disease progresses following treatment. So using these technologies, we're now able to integrate what the physician's seeing in the clinic with what we can do in the laboratory. And using these advanced technologies, we're progressing from standard technologies like karyotype flow cytometry to be able to identify very specific changes that are happening that allow us to understand most likely what drugs are going to be appropriate for those patients, especially as they start to fail therapies and need new therapies. The innovation of this is also adding an analysis component where we're able to integrate all the clinical and genetic information using a clinical software called NextBio to be able to track and monitor these patients longitudinally. And this is where we think it's most important in being able to identify high-risk multiple myeloma patients and following them over time with these technologies so that we can really understand how specific treatments, how patients respond individually to specific treatments and what these drugs are doing to the disease. The main goal is to be able to use these data in clinical trials nationally, internationally, so that any patient that's put on a specific agent, we can see what's happening within their plasma cells, within their myeloma cells at the molecular level, and then compare that to other patients on the same trial. This ultimately gives us the understanding of why patients do or do not respond to specific therapies.